Hello everyone, this is Pratyush Rai and I am a first year MBBS student, and in this video we are going to talk about the National Exit Test or the NExT examination. So the first and foremost thing is that this exam has been implemented in the 66 months of calendar which has been released for the 2024 batch by the NMC. This NExT examination or the National Exit Test will be required to be given by all the final year MBBS students who have completed their 4.5 years of study, all the foreign medical graduates who have got their degree as well as license from the respective countries, as well as the doctors who are already registered but they wish to do PG after the implementation of NExT. The main thing is that this NExT 1 course will be used for your PG entrance, and your university final year examinations as well as NEET PG examinations will be scrapped. Yes, they will no more be conducted after the implementation of NExT. So let's quickly check out the examination pattern of the NExT. So NExT will be conducted in two steps, NExT step 1 and NExT step 2. In the step 1, it will be a computer based examination, a theory examination and an MCQ based examination. So in this, your final year subjects, which are in the order of surgery and allied subjects, medicine and allied subjects, pediatrics, gynecology and obstetrics, ophthalmology and your otorhinolaryngology or ENT, these 6 will be your main subject papers of the NExT step 1. Apart from that, your MBBS part 1, part 2 and part 3, all these subjects will include their horizontal as well as vertical integration in the final year subjects, as we also call it as clinical aspects of the first or second or third year subjects. According to the gadget released by National Medical Commission, it says that NExT 1 will be having a 50% marks of pass criteria. That means in all the 6 papers you will have to score 50% marks in order to pass the NExT step 1 examination. After passing the NExT examination, you will be given a provisional license, after which you can start your internship, your 1 year internship. There will be no restrictions in the number of attempts for NExT 1, but yes, there is a cycle of MBBS which has to be completed in the 10 years. So at least you will have to just pass your NExT 1, NExT 2 including your internship for once in between these 10 years to at least complete your MBBS, and after that you can give it unlimited number of times to improve your scores. And yeah, NExT 1 and NExT step 2 has been always completed in a cycle. That means you can't just keep on giving NExT 1 to improve your scores again and again. If you give NExT 1, then you have to compulsorily give NExT 2 to complete this next exam cycle and then to improve your scores. NExT 1 will be conducted twice a year. That means if you are not able to clear some papers of NExT 1 in this year or in this attempt, then you can give it in the next attempt which will be conducted after the 6 months. Then after the next one you will complete your internship. Then after that there will be NExT 2. Now let's talk about the NExT step 2 examination. NExT step 1 examination had a 50% of passing criteria, but NExT step 2 will be just a pass-fail examination. It will be a clinical and practical examination, and it will not have any type of marking scheme. It will be an in-person examination just like a Viva Voce examination, and will be conducted by respective state health universities. Places where these universities does not exist, NMC will appoint competent bodies to conduct this examination. The key point of this exam is that it can be given only after completion of your internship, the successful completion of your internship, and it has to be completed within a cycle with the next one. One extra subject, that is orthopedics and PMR, it was earlier in the surgery and allied subjects in the NExT paper 1, but now it has been a separate paper for the NExT step 2. So you will be having your 7 subjects in the NExT step 2, that is medicine and allied subjects, surgery and allied subjects, your pediatrics, your obstetrics and gynecology, your ENT and your ophthalmology, and your 7th subject will be orthopedics and PMR as a separate subject. This will be just a pass-fail examination with no marking scheme, and after the completion of these both steps, NExT step 1 and NExT step 2, you will be given your license to practice as a physician. One important thing in NExT step 2 is that it has a supplementary exam provision. That is, if you fail in NExT step 2 in 3 or less than 3 subjects, then you can immediately appear in the supplementary examination conducted after a month. Otherwise, if you fail in more than 3 subjects, then you will have to appear in the next cycle of NExT examination, which will be conducted after 6 months. The same provision is there in the NExT step 1 with no supplementary examination. You have to compulsorily pass in all the 6 papers at one go, and you can reappear in the examination only after 6 months. The NMC gadget also mentions the examination pattern for the NExT step 1. It says that out of these 6 subjects, 3 will be your major subjects and 3 will be minor subjects. The surgery and allied subjects, the medicine and allied subjects, and obstetrics and gynecology, these 3 will be your major subjects that will be covering 120 questions and will be have to solve in 3 hours of examination. Your rest 3, that is pediatrics, ophthalmology and ENT or otorhinolaryngology, they will be your minor papers containing 60 questions to be solved in 1.5 hours. It also gives a provisional examination set schedule type of thing, which says one major paper and one minor paper will be conducted in one day in two sittings with 2 hours of break in between. So at one day you will first be having a major paper of 120 question, you will be having a 2 hours break, then you will be having your minor paper of 60 question or 1 point. And yes, the main highlight of this video was, or the main highlight of NExT is that you have to note the point that your NEET PG will be scrapped, your university 4th year examination will be scrapped, and next one scores will be used for your PG admission. The scores for next one will be used for the preparation of ranks for allotment of PG seats by the different counseling committees. So that was all from this video. Thank you.